The cases really took off in the fall, November, December, and then actually reached their peak about 15 days after Christmas. That is not a surprise to any public health official or expert who follows this. We were worried about that fact, and when you see that graph and that sort of area underneath the curve, those are lost lives. But we now see that we are coming away from that. Is that a combination of the effect of our initial vaccines? In part. It's also probably due to the fact that when people hear the news and see what's going on, they say, it's a bad time, and so they hold back. There's a cyclic nature of our behavior. We see danger, and we respond. So, and also, quite frankly, we now have a president who's not out there every day saying, don't be afraid of the virus. I don't know what the effect of the social media messaging is, but it has, as someone who does this all the time, it's been nice to have to fight against less medical misinformation.
I had my first shot of the Moderna vaccine earlier this week. I've got a lot of questions about it and the vaccines in general, but let me get your perspective if you know. Does one vaccine, Moderna or Pfizer, have a higher profile of adverse reactions? In other words, you hear a lot of people say, it's that second shot that gets you, brother. Is one of these vaccines more prone to produce a response negative in someone who gets it?
If you look into the trials, there's slight differences here and there, but I think that the main point that you just said is so important, which is the first jab, the first injection has some degree of a side effect or adverse sort of effects that we now expect. It's that second one. 50% of people who get the second Pfizer vaccine, for example, are going to have real fatigue, like they don't want to go to work fatigue. 29% will have a fever. And the reason I mentioned this is so important is that we have to lower the bar for people to get this vaccine. We have to have paid sick leave. We have to give expectations. What worries me is that people will avoid the vaccine because they hear that. And in fact, what we want to say is, look, this is our immune system working, doing its job. Let's make it really easy. Websites are crashing. That's a disaster. We need to make this so easy. There can be, as my friend Cass Sunstein says, there's no sludge here. We can have no sludge. If someone wants a vaccine, they should be able to get it right away. And we need to educate them on these expected side effects.
The other concern, doctor, is the South African variant. I mean, do you think we are testing enough for this variant? There's some medical experts say we're not, and therefore we don't really have an accurate gauge on how much it's spread here in the United States.
Yeah, it's a very important question. The South African variant has now been detected here in Massachusetts for the first time, and it comes at a moment when we have fewer hospitalizations. So I don't want bad news, I want good news. We know from recent studies that the Pfizer and Moderna vaccines do have some reduced response to these variants in the laboratory conditions in terms of neutralizing the antibodies. But we don't know what that means clinically yet. And so we have to not give this virus an opportunity to teach us a hard lesson. Every time a person gets infected, that person becomes a literal breeding ground for possible more mutations we haven't even dreamt up yet. And those could be the worst nightmare. Those could make the vaccines less effective. They could make the kids who have been relatively spared sicker. So I think that what we are learning here is the faster we can suppress virus transmission overall, the fewer of these variants show up, and then the fewer question marks we have.
Shepard Smith here. Thanks for watching CNBC on YouTube.